Think about the last time you got dressed in the morning. You made choices. What to eat for breakfast, whether to take your medication, which shirt to put on. But there's one choice you probably made without a second thought. You reached for your shoes, slipped them on, and walked out the door. And that choice, that single unconscious daily decision, may be quietly forcing your heart to work harder than it needs to. Now, I know what you're thinking. Dr. Reed, my shoes? Seriously? What do my shoes have to do with my heart? And I completely understand that reaction. I would have said the same thing early in my career. But after more than 2 decades working with patients over 60, and after reviewing the research on peripheral vascular resistance, arterial stiffness, and the mechanics of blood flow in aging legs, I have to be honest with you. This is one of the most overlooked connections in cardiovascular health today.
Size. Here's the silent problem. Most of us have been told that high blood pressure is about what we eat, how stressed we are, whether we exercise, and all of that is true. But almost nobody talks about what happens inside your blood vessels from the ground up, starting at your feet, with every single step you take. After 60, the prevalence of hypertension more than doubles compared to younger populations, and more than 2/3 of individuals after age 65 experience elevated blood pressure. AHA journals. Your heart is already working against more resistance. And when you put on a shoe that compresses your toes, restricts your forefoot, and locks your ankle into a rigid sole, you are adding a measurable burden to a cardiovascular system that is already running closer to its limits. By the end of this video, I'm going to give you a clear, step-by-step protocol, a shoe switch routine that you can start implementing this week. We'll cover exactly what happens in your blood vessels when your toes are squeezed, why your calf is your second heart, and why most shoes are silencing it, and what specific features to look for in footwear that actually reduces your heart's workload over time. But first, we need to start with the mechanism, because once you understand what is happening inside your body right now, with every step you take in the wrong pair of shoes, you won't look at your shoe rack the same way again.
Part 1. Your heart is fighting resistance, and your shoes are making it worse. Let me start with a concept that cardiologists talk about constantly, but rarely explain to patients. Peripheral vascular resistance. Think of your cardiovascular system as a water pump connected to a network of pipes. The pump is your heart. The pipes are your arteries. Now, if some of those pipes, especially the ones furthest from the pump, down in your legs and feet, become narrowed, compressed, or partially blocked, what happens? The pump has to work harder to push water through. Pressure builds. The pump strains. Peripheral vascular resistance refers to the resistance to blood flowing through the arteries and arterioles in the peripheral circulation. It plays a vital role in maintaining blood pressure and blood flow to all organs and tissues. An increase in resistance can directly increase blood pressure, damaging the heart, kidneys, eyes, brain, and other organs.
Prime revival. And here is the critical part. After the 6th decade of life, large artery stiffness rather than vascular resistance becomes the dominant hemodynamic factor in both normotensive and hypertensive subjects. This large artery stiffness can perpetuate a vicious cycle of accelerated hypertension and further increases in stiffness. AHA journals. Your arteries have lost some of their natural elasticity. They no longer spring back the way they used to. So your heart is not just pumping against resistance, it is pumping against rigidity. Now where do the shoes come in? When you put on a shoe with a narrow toe box, a typical dress shoe, a pointed sneaker, even many so-called comfort shoes, you are compressing your forefoot. You are squeezing together the metatarsal bones, the small vessels, and the nerves that run between your toes. A 2019 study published in the Journal of Foot and Ankle Research used ultrasound to measure what happens to the lateral plantar artery when the big toe is pushed inward, as it is in any tapered shoe. Blood flow volume was 22.2% lower after passive hallux adduction, with an initial drop of about 60%. Correct toes are, let that number land for a moment, more than 20% less blood flowing through a key artery in your foot, just because of how your shoe fits. But here's what makes this a cardiovascular issue, not just a foot issue. Your body is not passive. Arterial stiffness promotes inward remodeling of small arteries, which increases resistance, blood pressure, and in turn, central artery stiffness, creating an insidious feedback loop. AHA journals. When circulation is restricted at the periphery, resistance increases, and that resistance travels upstream. Over time, repeated daily restriction of blood flow at the foot level contributes to the pattern of elevated peripheral vascular resistance that researchers consistently find in older adults with hypertension. I want to be clear, a single pair of tight shoes will not give you a heart attack, but decades of compressing the vessels in your feet for 8, 10, 12 hours a day, that accumulates, that matters. Part 2. The second heart in your leg, and why most shoes are shutting it down. There is a structure in your lower leg that cardiologists call the peripheral heart. Most of my patients have never heard of it. It is your calf muscle pump, and understanding it may be the most important thing you learn today. Here is how it works. Every time you take a step, your calf muscles contract. That contraction squeezes the deep veins in your leg, propelling blood upward toward the heart against the force of gravity. In healthy veins, every time the calf muscle contracts, valves open, and up to 70% of the blood in the legs is propelled in one direction back toward the heart. When the calf muscle relaxes, the valves close and prevent blood from flowing backward. Venosin. The calf muscle pump is the motive force enhancing return of venous blood from the lower extremity to the heart. It causes displacement of venous blood in both vertical and horizontal directions and generates an ambulatory pressure gradient between the thigh and the lower leg. PubMed Central. This is not a minor detail. The heart cannot do all the work of circulation alone. It depends on the calf pump to assist with venous return from the lower body. When the calf pump is working well, it reduces the burden on the heart. When it is impaired, the heart must compensate. So what impairs the calf pump? Two things directly related to your shoes. First, a stiff, rigid sole. When the sole of your shoe cannot flex naturally as you walk, your ankle cannot move through its full range of motion. The gastrocnemius and soleus muscles cannot contract and relax with their normal efficiency. A systematic review found that shoe type significantly affects lower limb venous status during gait or exercise, and that changes in the muscle pump can modify venous pressure and blood flow. PubMed Central stiff soles reduce the mechanical efficiency of the calf pump, meaning less blood is returned with each stride. Second, heel elevation. Most traditional shoes have a raised heel, even by just a centimeter or two. This subtle elevation shifts your ankle into a chronically shortened position, reducing the calf muscle's contractile range. Rigid shoes with arch support don't allow for the flexibility and movement that intrinsic foot muscles and arches need to pump blood during locomotion. The intrinsic foot muscles and arches need to be mobile and flexible, yet strong enough to pump blood back up into the calf muscles. Correct toes are. The result is that blood pools in the lower legs. Venous pressure rises, and that rise contributes to the chronic increase in total circulatory resistance that makes your heart work harder. Let me give you a patient example. I'll call him Gerald. Gerald was 68, a retired engineer, in generally good health, but with stubbornly elevated blood pressure, sitting around 148/88, despite being on 2 medications and following a low-sodium diet. He walked every morning. He ate well. His cardiologist was preparing to add a 3rd medication. When Gerald came to see me, one of the first things I noticed was his shoes. Classic leather dress shoes, slightly narrow at the toe, firm soles, the kind he had worn his entire career and simply never stopped wearing in retirement. We talked about peripheral circulation. We talked about the calf pump. He was skeptical, but he was also frustrated. Over 12 weeks, Gerald made one primary change. He switched to wide toe box walking shoes with flexible soles, and minimal heel elevation. He continued the same diet, the same walks, the same medications. At the 12-week follow-up, his systolic blood pressure had dropped by 9 points. His cardiologist was cautious about attributing it solely to footwear, and that is fair. But Gerald told me something I have never forgotten. My legs feel lighter. I feel like I'm not fighting gravity anymore when I walk. That sensation is not random. It is the calf pump reactivating. It is venous return improving. It is the heart receiving better circulatory support from below. Part 3. The metatarsal arteries. A highway your shoes may be closing. Let me get more specific about the anatomy, because specificity is what turns general advice into real change. Inside every foot, neurovascular bundles, each containing a nerve, a metatarsal artery, and a vein, travel through the narrow space between the metatarsophalangeal joints in the forefoot. Once the metatarsal arteries reach the level of those joints, they branch and send separate arteries to the toes. That branching requires space. Conventional footwear, with its tapering toe boxes, squeezes this already tight space and compromises blood flow to and from the toes. Natural footgear. The consequences are layered. First, you get the immediate reduction in blood flow that the Jacobs study documented. That 22% becomes the baseline condition your foot operates in for as many hours as you wear those shoes. Second, the tissue downstream receives less oxygen. Healing is impaired. Third, and most relevant to heart health, the foot's own ability to act as a pump is compromised. There is also the matter of the posterior tibial artery and vein. In people who wear conventional footwear with tapering toe boxes, the abductor hallucis muscle becomes stretched under abnormal tension and pulls on the flexor retinaculum, restricting blood flow through the posterior tibial artery and vein and impeding circulation to and from the foot's plantar surface. Natural footgear. Many shoes simultaneously compress the foot in multiple directions, which may influence overall blood flow and reduce the potential for compensatory increased blood flow in collateral arteries. Correct toes are. This is not a minor plumbing issue. It is a systemic circulatory impairment, and it is happening right now in millions of people over 60 who are wearing the same shoes they have always worn, never once imagining that those shoes might be incrementally increasing the burden on their hearts.
Part 4. Arterial elasticity. Why flexibility at your foot protects the elasticity of your arteries. Now I want to connect the local, foot-level mechanics to the larger picture of arterial aging, because this is where the science becomes genuinely compelling. Cardiovascular diseases are the leading cause of morbidity and mortality worldwide, and the central underlying mechanisms are vascular aging and associated arterial stiffness. Arterial stiffness is characterized by loss of the Wind-Kessel function, elevated pulse pressure, and development of isolated systolic hypertension, causing microvascular dysfunction and end organ damage including heart failure, vascular dementia, and chronic kidney disease.
Thoughtful. Nature stiffness affects the heart by increasing left ventricular systolic load, and excessive pressure pulsatility also decreases diastolic pressure, which is necessary for coronary perfusion. Every organ in the body is perfused and therefore susceptible to microvascular damage when the aorta is stiffened and pulsatile pressure is high. AHA journals. Now here is what the research tells us about intervention. A 2020 study found that simple leg stretches can help improve vascular function after 12 weeks. The stretching regime made arteries less stiff, helping them dilate. Medical news today. The mechanism works through something called shear stress. When blood flows more freely through vessels, when the calf pump is working efficiently, when the foot pump is unimpeded, the increased flow creates shear stress on the endothelium, the inner lining of the artery. Healthy shear stress stimulates the endothelium to release nitric oxide, the molecule that causes blood vessels to dilate and maintain their elasticity. In other words, improving the mechanics of how your foot and calf circulate blood by wearing shoes that allow natural movement provides a regular, low-level stimulus for arterial health throughout the lower body. It is not dramatic. It does not replace medication. But it is real, it is measurable, and it compounds over time. The reverse is equally true. When peripheral circulation is chronically compressed and the calf pump is partially silenced, endothelial shear stress decreases. Nitric oxide production falls. Vessels lose capacity to dilate. Arterial stiffening precedes the development of hypertension, and current antihypertensive drugs are not adequate to alter the pathological process of vascular stiffening or even selectively reduce systolic blood pressure in isolated systolic hypertension. AHA journals. This means the only meaningful long-term strategy is to address the underlying vascular environment, and the peripheral circulation is part of that environment. Part 5. What the science specifically recommends: width, flexibility, and heel height. Let me now be concrete about what to look for because good advice must be specific. On toe box width, a systematic review published in BMC Public Health found that footwear characteristics significantly affect lower limb venous status during walking and exercise, making shoe selection a key factor in circulatory health. Wide toe boxes that allow natural toe splay promote optimal blood flow and nerve function. Dr. Comfort. The practical rule: your shoe should be widest at the tips of the toes. When you stand in the shoe, all 5 toes should be able to spread slightly without touching the sides. On sole flexibility, rigid shoes with arch support don't allow for the flexibility and movement that intrinsic foot muscles and arches need to pump blood back up into the calf muscles during locomotion. An artificial arch support will also prevent the ability of the foot arch to naturally pronate while walking, providing an unnecessary compressive force while the foot vasculature should be filling. Correct toes are. A practical test: hold the shoe by the heel and toe and try to bend it at the forefoot. If you cannot compress it with moderate pressure, the sole is too rigid. On heel height, even moderate heel elevation, the kind found in most traditional shoes, chronically shortens the Achilles and calf complex, impairing the calf pump's range of motion. Look for shoes with a heel-to-toe drop of less than 8 millimeters. Transition gradually if you have worn elevated heels for years. Your Achilles and plantar fascia will need weeks to adapt. On weight, heavy shoes require more muscular effort to lift with each step. For older adults, lighter footwear reduces gait fatigue, encourages higher stride frequency, and thereby increases the number of calf pump contractions per hour of walking. More contractions mean more venous return and more frequent activation of endothelial shear stress. Let's bring this all together. Here is your 5-step shoe switch routine, starting today. Step 1. The toe splay test. Put on your current shoes and stand. Look at where your toes sit. If any toe is touching the side of the shoe, or if you cannot wiggle all 5 toes independently, your toe box is too narrow. That shoe is compressing your neurovascular bundles with every single step. Step 2. The bend test. Hold your shoe by the heel in one hand and the toe in the other. Bend it at the forefoot. If it resists, the sole is too rigid to allow proper calf pump function. You are, quite literally, walking in a splint. Step 3. The heel drop check. Look at your shoe from the side. Is the heel significantly higher than the ball? That elevation, even by a centimeter, shortens your calf muscle thousands of times every day over a lifetime. Choose shoes where the heel and ball are closer to the same height. Step 4. The gradual transition. Do not switch to minimal footwear overnight. Your tendons and plantar structures need time to adapt. Wear your new shoes for 1 to 2 hours on day 1, adding 30 minutes per day over the following 2 to 3 weeks. Transition without injury. Step 5. 5 minutes. Barefoot. Every morning. On a clean, safe indoor surface, carpet or wood floor, walk barefoot for 5 to 10 minutes each morning. This activates the intrinsic muscles of the foot, restores natural toe splay, and engages both the foot pump and the calf pump without any external restriction. Many of my patients describe this as the single change that made their legs feel most noticeably different within the first week. I want to speak to you directly for a moment. I know this sounds almost too simple, but simplicity is not the same as insignificance. The mechanisms we discussed today, peripheral vascular resistance, the calf muscle pump, arterial endothelial shear stress, plantar artery restriction, these are documented, peer-reviewed physiological processes. And the beautiful thing about this intervention is that it costs nothing extra. You are going to buy shoes anyway. You simply need to buy different ones. Your body has not given up on you. Your calf muscle still wants to function as a peripheral heart. Your arteries still have the capacity to respond to healthy blood flow with improved elasticity. The foot pump is still there, waiting to be unblocked. The surgeon holds the scalpel, but the choice of shoe is yours. I am asking for a 30-day commitment. For the next 30 days, apply these 5 steps. Walk in shoes that give your toes room to breathe, that let your calf contract through its full range, that do not elevate your heel away from its natural position. Add 5 minutes of barefoot walking each morning on a safe surface. At the end of 30 days, pay attention to your body's signals. Are your legs lighter at the end of the day? Is ankle swelling less pronounced? Is your morning walk feeling easier? And as always, please discuss any changes in your cardiovascular health with your physician. If you are managing hypertension, heart failure, peripheral artery disease, or diabetes, consult your doctor before making significant footwear or activity changes. This video is educational information, not a substitute for personalized medical care. Before you close this video, I want to ask you one thing. Look down at your shoes right now, or think about the pair you wore today. On a scale of 0 to 10, with 0 meaning my toes feel completely free and 10 meaning my toes feel compressed, write that number in the comments below. I read every comment, and knowing where you are starting is the first step. If this video opened your eyes to something you had never considered, share it with someone you care about who is over 60. This information belongs in every aging body, not just yours. Take good care of your feet. They are carrying more than your weight. They are carrying your heart.